Countries around the world are looking to Israel as a model of how vaccination could bring a return to normal, as the country records no daily death cases in the past 10 months. To help better understand the country's success in fighting against COVID-19, I'm here at the Embassy of Israel in Kazakhstan to meet Ambassador Liat Wexelman. Madam Ambassador, thank you for your time. With over 57% of the population vaccinated, Israel may be now reaching herd immunity, and this is a tremendous achievement. Could you please tell our viewers how it was made possible?
First of all, Israel is called a startup nation due to a high level of high-tech and innovation in our system and digitalization. Part of it is, of course, digitalization in the healthcare system. Everything is digitalized. We have a database of the people. So people were able to be summoned to get the vaccine by SMS message, by instant message, and then for the second vaccine, they also got a message. So we have a good database. And second reason, we have medical insurance for every citizen, and it's mandatory. So every citizen in Israel has mandatory medical insurance. People got vaccinated very efficiently and very fast, and it's free. The insurance makes us enables us to have healthcare services free.
Well, since the start of the vaccination campaign, Israel, as I said, has been the global leader in the amount of vaccination doses per head of population. And the world really looks at Israel as the model of how we can go back to normal. And while anti-vaccination sentiments are really strong elsewhere, and the effects of the anti-vaccination movement are actually hindering the speed of the vaccination campaigns in other countries, how has Israel been able to avoid the effects of that? And do you think the public trust in government has played a role in the success of the campaign?
Indeed, I must agree with you. We have high level of public trust in governmental system and in healthcare system. We call them also healthcare heroes. I know that in some countries there was a high level of criticism for healthcare employees, for medicine, for doctors, not in Israel. For us, and I'm not going to be cynical, it's sincere, they are healthcare heroes. We believe that they save lives, and we believe our healthcare system. So when people got the opportunity to get vaccinated, everybody went. And I can share with you that when there were other epidemics before, if it was polio, even it was a very small amount of people at risk, people went to get the vaccine. So, yeah, we believe in our healthcare system, and I think it works well for us.
Now, with the new vaccine passports, the Israelis are now able to go back to gyms, restaurants, theaters, stadiums. The outdoor mask mandate has also been lifted in the country. Is the life in Israel returning to near normalcy?
In fact, recently, I think it was last week, was published research by Israeli doctors and researchers that in Israel we haven't we are supposed to have herd immunity, because when many people are vaccinated, it works also for the non-vaccinated. And now outdoors we don't have to wear masks.
Absolutely.
So it's already a good.
That's a relief.
It's a positive development, and hopefully businesses are going to be back to usual. And yeah.
How have the people been affected economically and socially by the pandemic?
Of course, we had a lot of unemployment. It was a tough economical crisis, especially for the small and medium-sized businesses. Like, for example, hair salons, independent people, or people, for example, that have a wedding business for arranging weddings or ceremonies or hotels, accommodation and venues for, So It's similar to the rest of the world. Yes, we don't have tourism and we don't have big events, seminars or familiar events or big birthdays. So, and of course export. We had a problem with export because it was problem of exporting goods. Yeah.
The country is also planning to vaccinate children aged 12 to 15 as soon as the vaccination use is approved for this age group. What's the public reaction to that? I know it's quite a sensitive topic for many here in Kazakhstan, at least.
Yeah, I know that this is a sensitive topic in other regions, in other countries, but not in Israel. In Israel, people have high level of trust in the healthcare system and the governmental system. So if the healthcare systems advise us to get the vaccine done for children to a certain age, from a certain age, we'll do it. I am a mother myself, and I have complete trust in our healthcare system. If they give recommendations, I always follow them.
With Israel getting its herd immunity, however, the Palestinian territories have not received their share of vaccines. They've just received their first shipment of 60,000 doses as part of the COVAX international vaccine sharing program. How does that affect the situation in the region and Israel?
We don't want to have a health crisis at our neighbors, yes, because we believe that this is a global pandemic, and we know this is a global pandemic, so we want to avoid spreading the pandemic. So therefore we have several steps that we took. First of all, I would like to remind that according to the Oslo Agreement, the full responsibility also for healthcare issues, it's upon the Palestinian Authority. It's their responsibility to get it done. But anyway, we have a lot of employees, workers coming from Palestinian territories to Israel every day, they on daily basis. So we so we vaccinated 110,000 of them free from our vaccines that we purchased. And when there was the beginning of the coronavirus and it was the peak, Israel also helped in training the doctors and the medical teams of the Palestinian Authority, and we donated medicine. And now when they are going to get some vaccines they purchased or get by donation, we also coordinate and assist them to get them. So we don't want to have a medical crisis or pandemics there, we assist them. And it's not always appreciated.
Madam Ambassador, the reason why I asked is, of course, because there are actual human exchanges between the two countries on a daily basis, while Israel remains actually closed and keeps its borders closed for international travelers, and there's still close contact with Palestine. Israel is quite notorious for its high level and high quality of medicine, of healthcare. And medical tourism is quite developed in the country, and many Kazakhstani people know that too. What do you connect that with?
I'm very glad that many people go to medical treatment in Israel, and even when we had the peak in COVID, humanitarian cases got special approval and went to treatment in Israel. And I think another aspect that is very, very important, that doctors are going to trainings in Israel long-term internship. It can be 4-5 months, even 1 year or more if they have a research, academic research. And also to stress out that during the COVID, when there were very tough restrictions, those doctors got special approval and they went for the training and internship in Israel. I think this is also a very important part of our cooperation. And you asked me about the reasons why the healthcare system is so developed. I think it's also because the government invests many resources in this topic of healthcare. First of all, we have this mandatory healthcare insurance. We have very good hospitals. We have doctors, and our doctors are going to trainings and internships outside of Israel.
Madam Ambassador, I'd like to talk about Kazakh-Israeli relations, and especially tourism travel. Israel stopped issuance of all visas last year in March, has kept its borders closed for international travelers. on purpose of tourism. When do you project international travel and visa issuance procedures to resume?
Israel, similar to other countries, closed its borders when the pandemic began.
Absolutely.
And now, since we have this high rate of vaccinated people, and we are trying to get back to normal life, we are opening our borders to people that has been vaccinated or that can prove that they had coronavirus and they already recovered from COVID.
Israel has procured for itself 2 types of vaccines developed by Pfizer and BioNTech. It's also procured another deal with Pfizer and Moderna for a boost dose of vaccine for the future. And for travelers coming from Kazakhstan, and Kazakhstan has procured for itself only Eastern vaccines, will these Eastern vaccines be acknowledged in Israel when international travel is resumed, and will it be a political decision?
No, it's not a political issue. It's issue of health and public security. And yes, it's already for the last couple of weeks, people that are vaccinated with whatever vaccine it is. It can be Sputnik, it can be QazVac, whatever is approved in their country. They can come to Israel to show that they had been vaccinated by 2 doses, and then upon arrival to Israel, they have a epidemiological test, and then they're approved to enter without quarantine.
Well, I think many of our viewers are happy to hear that, actually. Let's talk about the other types of cooperation. Kazakhstan is one of the key oil suppliers to Israel. What are some other areas for economic cooperation?
I think the main subjects for cooperation, the main fields for cooperation are, first of all, agri-tech, agribusiness, agriculture technologies. I think you know the drip irrigation system. It's very famous. It was Israeli patent for many years ago, and it's still working here across Kazakhstan. And other aspect is innovations. It can be digitalization, it can be cyber security. We have also direct investments. We have joint ventures. I think the most sufficient and long-lasting and endurable partnership is to form a partnership between Kazakh and Israeli entrepreneurs. It can be in Kazakhstan, on Kazakhstani soil, or in Israel, and to open joint business together. It's not an issue only of selling or buying or exporting, importing. It's, for example, I can give you some examples of Israelis that found local good partners, and they opened a business, and they work together for years. And then they export maybe to third countries in the region or elsewhere. So I think this is the best example to have a durable and sustainable cooperation for years, not only to sell a shipment of something, but to have a durable partnership.
And these durable partnerships, are they built upon Jewish immigrants who have left Kazakhstan, and vice versa, Jewish community here in Kazakhstan?
Sometimes, but not necessary. Some of the people that are having success here in the businesses don't know Russian. They are not from here, not originally from here. It's also a question of commitment, of intentions, but sometimes, of course, the language, the Russian language, can facilitate it.
How about cooperation in security? I know that Israel's provisions of military technologies to Kazakhstan, but also counterterrorism assistance to Kazakhstan has played a big role in establishing the partnership in security.
We had several conferences in Israel where Kazakh experts participated, and we had some joint seminars here in Kazakhstan. I think this is a very important issue for cooperation.
Madam Ambassador, what has been Israel's international assistance and aid to the countries here in the region during the pandemic?
Mashav is an organization for international cooperation under Ministry of Foreign Affairs. And we had many projects done during the last year. Pandemics made us re-evaluate our projects. As you know, many projects were cancelled. For example, all the international trainings, international seminars, and then we had to redefine our values and our targets. So we had a lot of projects done thanks to finances from MHAV under our Ministry of Foreign Affairs. First of all, we gave twice humanitarian assistance to the Healthcare Ministry of Kazakhstan. First time we gave protective masks and suits for the medical employees, for the healthcare workers. Mm-hmm. And second, we gave a big shipment of pulse oximeter for the healthcare ministry. It also helps to treat and to diagnose COVID. Mm-hmm. And it was upon the request of Healthcare Ministry of Kazakhstan. So I believe it's important to note that we provided this humanitarian assistance during the time that the pandemic in Kazakhstan was increased, and also in Israel. So also we had some tough times. The same time we delivered the humanitarian assistance to Kazakhstan, we made this happen because it's important to help our allies and our partners not only when everything is fine, but also in tough and difficult, critical situation. I think this is a real friendship. And besides this, we have here across Kazakhstan around 700, 800 graduates, alumni of MHAV, that participated in the courses on different topics. For example, it may be in agriculture, irrigation, gender issues. It can be also in how to build a business. It can be also in rural development, mm-hmm. or digitalization or acceleration programs. And those people that were trained in Israel for 1 month or even more accumulated the knowledge, and when they come back to Kazakhstan, they are supposed to spread it. And some of them really spread the knowledge. They sent other trainees to Israel. Now it's done on digital platform, on Zoom. But before it was with going to Israel for several weeks or months or even more. And the most prominent MHAV alumni received grant from our embassy to open or to enlarge their existing business. Mm-hmm. The majority are on social entrepreneurship or education of children with special needs, with autism. Mm-hmm. And we try to focus not only in Nur Sultan, and we provided the grants with specific goal to go outside the capital, to Semey, to Aktobe, and to other regions. I believe it's very important.
Madam Ambassador, you've worked in Kazakhstan for 2.5 years, and you've observed how the country's been before the pandemic and during. What are your impressions of how we have dealt with the crisis that has been?
Economic crisis.
Exactly.
Or pandemics?
Both the pandemic and also the economic challenges caused by the pandemic.
I think now Kazakhstan is experiencing also one of the peaks of the pandemics according to the data I see. Mm-hmm. But this time Kazakhstan is dealing much better than the big wave that was in the summertime. Mm-hmm. It seems like the healthcare system is much more prepared, and there is more awareness in the public. Mm-hmm. And I'm very glad to see that people are getting the vaccine. It doesn't matter which manufacturer of the vaccine. Here it's Sputnik, and congratulations on with the QazVac. QazVac, yes, so good for you for developing it. I think now it's getting better. Hopefully we'll be back to normal life soon.
Madam Ambassador, on a personal note, how many women ambassadors do you meet throughout your career? How often and how
not often.
How
not
common is that?
Yeah, I have some colleagues in the Israeli Foreign Ministry that are female ambassadors, and I meet here also in Kazakhstan female ambassadors, but we are not we are half of the population, but not half of the ambassadors yet.
The reason why I'm asking is COVID-19 has especially been a bigger challenge to women. Female unemployment has been higher than of the men. Where measured, the gender pay gap remains substantial for over a decade here, at least in the region. And now there are more and more women reverting back to their traditional roles during the COVID-19 because of the bigger brunt of the burden at home. What is your stance on that, and what would you say?
Yeah, I think the COVID crisis is affecting everybody, but it's affecting more the people that are from the more vulnerable part of the population. It can be single moms, it can be people with disabilities, so yeah, It's a sad thing that it's happening, but I don't believe that the women should stay back. They should try to move forward, and I think we deserve an opportunity, and we deserve to be treated as equal in the possibility, in the employment market, and also in the wage.
Madam Ambassador, what is your hope for the next few years, and what do you think are some of the biggest lessons learned?
I think the biggest lesson is the world is global. And we talked about globalization years before, but now we can feel it. Like when everything was closed, people could not travel around the world, and even during lockdown could not leave the city or could not leave the community. It was like we felt, wow, we are locked down. It was tough. But I hope, and also it was a lesson for people to know the values of family life, that the most important is your family, and to take care of yourself, to respect your health, to respect the regulation, to respect others.
Well, Madam Ambassador, thank you.
Thank you, Ahmed.